Hello, my name is Hans Carlson. I'm an ear, nose, and throat surgeon. I work at Carolina ENT through Bon Secour, St. Francis. I always sort of knew when I was a youth that I wanted to become a doctor. When I attended medical school, I was really enamored by most of the surgical specialties, especially ear, nose, and throat surgery. I really enjoyed the anatomy of the head and neck, and that's what really drove me to go into the field of ear, nose, and throat surgery. I think it's paramount, the patient-physician relationship. Developing a good relationship with your patients really is the key to helping them out and to patient care. Being able to listen to them, educate them is very important. With an initial visit, the importance is figuring out what the primary complaint is, whether it's a sinus issue, an ear issue, a neck mass, and then understanding the history of the problem that the patient's coming to us with, and then we sort of move on after a physical exam to develop a treatment plan for them. I treat a variety of complaints of the head and neck, as I mentioned earlier, everything ranging from sinusitis to ear infections to neck masses to thyroid problems. So it's a very wide variety of pathology that we see in our practice. I think it's the relationship that you develop with your patients. It's very satisfying to see them get better and improve from the initial clinic visit when you diagnose them with a problem to helping them out, whether that's medically or surgically, and then seeing them improve down the road and having them come back for post-operative care is very satisfying. I like hearing success stories, seeing patients improve, whether it's a treatment medically or surgically, and having them get better, hearing their success stories, how they feel better, the care that they received at Bon Secour St. Francis is great to hear. Well, I think the most important thing is commitment, making sure that you do everything in your capabilities to help out your patients. Beyond that, I think being a good listener is incredibly important, so that you can really listen to and understand your patient's complaints, and that's really the beginning of that patient-physician relationship that you develop. Beyond that, I think patient education is very important, and being able to teach your patients about the problems that they are having, so that they can understand it as well is a very important part of the position. I chose to practice at the Bon Secour St. Francis Medical System mainly based on the relationships that I developed at the initial interview process. Everyone from fellow physicians to administrators to nurses to assistants are wonderful people that were really genuine, that I felt like I could work with and develop a good rapport with over a long career. I think the multidisciplinary approach is important for most fields of medicine, especially with ear, nose, and throat surgery. I take care of a lot of head and neck cancer patients within my practice, and they can be very complex patients that often require consultations with multiple different specialties, radiation oncology, medical oncology, speech pathology, nutritionists, dentists, and working with all of those different specialties is very important so that we can take care of patients to the best of our capabilities. I think working in a faith-based environment is very important. I think it provides a very comfortable environment for physicians and folks to work in at the hospital, as well as for patients. I find that inevitably we see patients with difficult problems, and working in a Catholic-based hospital provides a lot of comfort for them and provides them a very comfortable environment to have their care taken care of. At my practice, Carolina ENT, I see most of my patients as referrals from family physicians and internists within the Bon Secour St. Francis Medical Group. I've developed a good relationship with a lot of referring physicians that provide the majority of patients that I take care of, both medically and surgically. And I think that relationship with the referring providers is paramount to being able to take care of patients with some complex ear, nose, and throat problems. I think there's a lot of very interesting topics within ear, nose, and throat surgery that are talked about locally and nationally. There's been an epidemic of increase in a lot of head and neck cancers in young, healthy patients associated with the HPV or human papillomavirus that we are seeing more and more in our office. I think it's a hot topic that research is still ongoing, but we're learning more and more about how to take care of these patients. Another topic that we're seeing more and more of in ear, nose, and throat surgery is advances in sinus surgery. Chronic sinusitis is one of the more common patients that we see in our office, and modern medicine has allowed us to develop new technologies, including balloon sinuplasty and functional endoscopic sinus surgery, so that we can take care of these patients in a minimally invasive fashion. I like the outdoors. I enjoy traveling. I enjoy playing golf and participating in a lot of other sports.